So now we discuss about bacterial infections. Okay. First question is, which of the following is not characteristic of congenital syphilis? No, the question is not characteristic of congenital syphilis. The answer is complex. The characteristic features of congenital syphilis include interstitial keratitis, mulberry molars, and notched incisors. Okay. Second question is, a bacterial disease with oral manifestation is diphtheria. Next, leutiglossitis is an intraoral manifestation caused by Treponema pallidum. Okay, leutiglossitis is an intraoral manifestation which is caused by Treponema pallidum. Syphilis becomes seropositive in mucopatches, that is secondary syphilis. Next, sulfur granules in pus are seen in Actinomyces israeli. Next question is, multinucleated giant cells are least likely to be found in which of the following disorders? It is least likely found in Streptococcus pneumoniae. Next, a case presenting with a grey colored pseudomembrane whose removal is difficult and painful can be diphtheritic lesion. Next, oral ulcers that are painless are associated with primary syphilis. Rigidity of the facial muscles, rhizus sardonicus, is associated with tetanus. Complications of Vincent's angina is pneuma. The bacteria observed as a causative organism in case of recurrent aphthous ulcer is Streptococcus sanguis. Hansen's disease is another name of leprosy. Cancerous involvement is seen with syphilitic glossitis. Hard swelling at the angle of the mandible with numerous draining sinuses is most likely actinomycosis. Which diseases are infectious but not communicable? Tetanus. Oral lesions are rarely seen in tuberculosis. Spasm of masseter muscle occur in tetanus. The oral lesion of syphilis that is highly infective is mucus patch. Lesions of the oral tuberculosis are associated with all of the following. Answer is central cessation, then giant cells in the center and presence of epithelioid cells. Next, strawberry tongue is associated with scarlet fever. Hutchinson's triad include hypoplasia of the incisor and molar, eighth cranial nerve deafness, and interstitial keratitis. Again, Hutchinson's triad. Okay. The answer is hypoplasia of the incisor and molar, eighth cranial nerve deafness, and interstitial keratitis. Which of the following oral structures are not affected in leprosy? Gingiva is not affected in leprosy, but all other structures like hard palate, tongue, and soft palate are affected by leprosy. Gamma occurs in tertiary stage of syphilis. All of the following can give rise to the membrane on the pharynx. The answer is Candida can give rise to membranes on the pharynx, Corynebacterium and Vincent's angina can. Actinomycosis is a bacterial infection. Note that point. Actinomycosis is a bacterial infection. Mostly we will think that it will be a fungal infection because mycosis is there, but it is a bacterial infection. The causative agent for oculoglandular syndrome of Parinaud is a Bartonella henselae. The causative agent for oculoglandular syndrome of Parinaud is Bartonella henselae. Clinical feature of which of the following include conjunctivitis, urethritis, mucocutaneous lesions, and arthritis? It's Beckett syndrome. Oral ulcers which occur in groups persist for about 6 weeks and leave scars on healing are recurrent aphthous major. So that persists for about 6 weeks and leaves scars on healing. That type of oral ulcers are come under recurrent aphthous major. Next, splitted papule at the corner of the mouth due to secondary syphilis. Positive pathology test is seen in Beckett's disease. Trismus is due to the infection by Clostridium tetani. The first consideration in the differential diagnosis of a painless palatal perforation would be syphilis. Pneuma is cancrum oris. Recurrent aphthei resemble recurrent herpes in that symptoms are similar. Secondary syphilis occur after 6 weeks. Kissing disease is also known as glandular fever. Which of the following ulcers are characteristically painless? They are primary syphilis. The best laboratory test to use in the diagnosis of lupus vulgaris in the oral cavity is biopsy. Most common site of tuberculous lesion in the oral cavity is tongue. Lockjaw indicate spasm of the masseter muscle. Early tongue changes seen in the scarlet fever is strawberry tongue. Canker sore is otherwise commonly known as recurrent after ulcer. The oral lesions called mucus patches is usually multiple grayish white plaque associated with no pain. The explosive and widespread form of secondary syphilis in immunocompromised individual is known as lues maligna. Tuberculous ulcer of oral cavity is usually painful. Crohn's disease has oral ulceration similar to major aphthous ulcerations. Botryomycosis is a dash disease, that is a bacterial disease. Weim Slitback test is useful in the diagnosis of sarcoidosis. Oral lesions of secondary syphilis include all except chancre of the tongue. A patient has asymptomatic painless burrowing ulcer in the palate. He might be suffering from syphilis. Primary antibody deficiencies are characterized by recurrent bacterial infections. Aphthous like ulcers are seen in Beckett syndrome, Sweet syndrome, PFA, periodic fever, acute pharyngitis, aphthous stomatitis. Next, which of the following is a painful ulcer? Oral chancre. True about syphilis is it is oral lesions are seen at any age. Next, a pediatric patient belonging to the sub-Saharan Africa with a severe malnourishment living in close proximity to Fusobacterium necrophorum is suffering from nausea. This patient with a kind of lesion shown in the image has come with a history of developing such ulcers repeatedly along with the redness of the eyes and scrotal ulcers. His treatment options include all of the following drugs. The answer is colchicine, pentoxifillin, and thalidomide. These all are used in treatment of the ulcer. And if I get such picture, that's just an ulcer in the lateral border of the tongue. Okay, that is the image. You cannot see, but if I get in the future, then I